Hello, everybody. You know that the PCOS doesn't exist anymore. I know the name anyway. As of May 2026, it is PMOS now. Polyendocrine Metabolic Ovarian Syndrome. If you are still seeing or study this as polycystic ovarian syndrome, you are one guideline cycle behind, and I want to make sure that's not you. By the end of this video, you will know exactly what changed, why the Lancet consensus group changed, what the three letters of PMOS actually stand for clinically, and where we are in the rollout. This is not switching overnight, so you need to know what to expect on charts, exams, and patient conversations over the next few years. Let us start. We will start by, at a glance, old versus new. Old PCOS, which is the polycystic ovarian syndrome, is strictly ovarian. Gynecological implies localized pathology. The new is PMOS. It's a multisystemic, captured endocrine and the metabolic pathways as well. The cyst is a mass, and because implies pathological ovarian cyst is not actually part of the condition, while the new PMOS omitted focus shifts to arrested follicular development and endocrine dysfunction. That's why PCOS, polycystic ovarian syndrome, and PMOS, we will explain. Because high productive focus can cause distress in pronatalist culture, reduce the stigma of PMOS, prioritize systemic, metabolic, and endocrine framing, so it will decrease stress. Why it changed? Why the name changed? Scientifically, it's inaccurate. Polycystic is a misnomer. Affected individuals have arrested antral follicles, not true pathological cysts. Multidisciplinary reality driven by insulin resistance, hyperandrogenism, neuroendocrine anomalies, increase gonadotropin releasing hormone, to LH pulsatility, and ovarian dysfunction together, not in isolation. Clinical hurdles. The old name contribute to diagnostic delay. Up to 70% of cases went undiagnosed, fragmented care, and underfunded research. So how we will break PMOS? P for polyendocrine. Captures the multi-glandular interacting hormone networking driving the condition. There is insulin resistance in 85% of patients, 75% of lean individual affected to elevated ovarian adrenal androgen, altered anti-Mullerian hormone, increase LH pulsatility, so it's polyendocrine. And M for metabolic. Integrates metabolic sequelae that are inherent to the condition, not incidental to it. Central adiposity, type 2 diabetes, risk dyslipidemia, MI odds ratio 2.5. O for ovarian, preserves the link to follicular dysfunctional ovulatory disturbances and reproductive outcome without misleadingly referring cysts. Follicular dysfunction, menstrual irregularity, ovulatory disturbance, reproductive outcome. How we will implement, it's not over one night. The reference of the Lancet for May 2026 make 8 stages global implement strategy. Let us start step by step. First stage is dissemination, academic publication, medical textbook updates, and curriculum alignment. Then, second stage, resource development, a multilingual patient and clinician tool. Global campaign, professional society toolkits at patient events. Health system integration, updating EHR systems and medical school curriculum. Policy and funding, aligning research grants and medical journal. ICD coding, engaging with the WHO to integrate PMOS into the International Classification of Disease, ICD. A transition period, they give managed a 3-year transition period to monitor, evaluate, and refine terminology as science evolve. And guideline updates, full integration into next international evidence-based guidelines scheduled for 2026. We are expecting some updates in the guidelines and exams and patient information and conversation. Hoping you find this video useful. Check the box of description for more useful links and follow the channel, and see you next video. Thank you.